Hello everyone, so this is the last week of the semester, so I hope you're doing all great, and let's light up this class with the great results. Alright, so there are two more topics, and the topic 11 on the health and the population, or the population health. This is very large topic, and mostly you can read over my lecture slide because this is very large topic because so for example, the sociology of the medicine or the medical sociology, this is a very big course in sociology or other disciplines. So I will try to summarize, or I will just try to pick up on which parts are very important for your final exam or other parts. But I think that the final exam is the only one on the remaining assignments you will need to finish if you already have done on the weekly quiz due on June 30th. And another one is the alternative quiz of the weekly quiz number 3. But other than that, so this is very important topic. So let me just keep going and check which are very important. Alright, so as I experienced the very bad cold last week or over the last weekend, the health is very important. So not only because it determines my performance in the work setting, but also that will make you work more efficiently or not very efficiently. So it's very easy to agree that the health of the individual, so your health condition and my health condition, these are very important. But how about the general level of the population of the health? So the without health condition of individuals and without health condition of the community, it's not very easy to recover, and sometimes it's not very useful because without health condition, we cannot perform our duties very efficiently. So in the United States, the one of the most developed country in the world, so there are many of the institutions that serve on the research facilities or serve on the functions and generally the policy of the health. So NIH is the National Institute of Health, located in this area. Also, the Center for the Disease and the Control and Prevention. You might know this word and this institution because of the COVID-19. And anyway, in most of the cases, the volumes of the amount of budget in those institutions will be very helpful to prevent any further pandemic situations or other things. Sorry, my my throat condition is not so good yet. Also, in the world, not only limited in the United States, the World Health Organization, we call the WHO, this is also very big and a very large institution serves the health survey or the health policies. So, the population health also is also called as the medical sociology and the medical issues of the population. These are all relevant with the health issues. What we learned as the mortality, which is a part of the population dynamics, but also the morbidity is meaning that the illness and the disease and the sickness. So, the mortality is about the death and the the end of the life, and the morbidity is about the sickness or illness like that. So life expectancy, we saw that across all the countries on the globe, the women are more likely to live longer than a man. So usually the women are living longer. So it means that they will stay more time in their elderly. And as you know, as the common sense and very general knowledge, the health condition of the older adults, so compared with the younger generation, the health condition of the older adults are more likely to be worse than compared with the younger generation. So in other words, if they stay in the longer time in the elderly or in the older adult period of time, then they are staying longer time in the bad health condition. So that's why the women are more likely, the women are less likely to suffer from the high levels of the mortality, which means the woman would like to have the lower levels of the mortality condition, so lower rate of the death or something, but the women are more likely to have the morbidity issues. It means that they are staying longer time in the bad health condition. So these are the explanations. Averagely, women live longer, but averagely, women spend more time in the sickness or the bad health condition. So again, the living longer, so it means that having the longer life expectancy, these are usually better because because they are enjoying more time in their life, and mostly compared with the underdeveloped countries or the less developed countries, the developed countries would have the longer life expectancy. So the longevity would mean usually and mostly the advantages or benefit. However, so we cannot say that the longevity is always advantageous because, as I mentioned just before, the living in the older age, longer time means having the bad health condition or relatively the worse health condition in the longer time. So, as we could see, as we checked in the mortality issue last week, so cardiovascular disease, there are more chances of the woman to get the cardiovascular disease because they are average. The women are the older. The immune functions and the disorders of women are higher. The mental health disease, but in most of the studies, there are some of the debates, but they are mostly very equal in terms of the list. And the depression and other, so anxiety or depression disorders, there are higher risks of the woman. But substantive, the abuse disorder, like a drug abuse or the physical violence abuse like that, the males, so the men are more likely to suffer from those diseases. So we cannot generalize the men are healthier or the women are healthier in many cases, but we can compare on the risks of the specific disease like that. And the woman, so based on the country and based on the age groups and based on the development level, we can say the women are healthier or the males are healthier, but based on the levels of thing, sometimes because of the discrimination, the women are suffering more of the health disease because of the stresses. But based on the cultural differences and based on the cultural expectations, the males are more likely to suffer from the physical, the threatness and the physical the injury like that. So there are some patterns of the health conditions by the gender. And so if you were in the classroom, I would ask this question that to know about or to tackle about the inequality in the health condition in the pandemic situation. So as you can guess, their levels of the inequality, I mean their pre-existing inequality matters a lot in terms of the time of the pandemic situation or the macro levels of the risks. So, for example, those who were in the very bad health condition before the COVID-19, they are more likely to suffer from the health conditions or the mortality conditions after the COVID-19. But other than that, so the life expectancy around the 2020. So as you might remember, on the COVID-19, the upsurge of the COVID-19 started from the spring of the 2020, and you can see that so after 2020 or in the year of the 2020, the life expectancy decreased a lot because of the COVID-19. So you might say that about 2 years or 3 years of the decrease of the life expectancy is not a big matter. But as you know that in the United States, there are 300 more million, so 340 million people in the United States only. So if we multiply 2 or 3 years to the 300 million or 340 million, and that's a very, very huge number. So that's why the population, so the health condition of the population is a very, very big issue because the volume or the amount of the people is very, very high in the population health condition. So the risk society is a very famous theory in sociology. So it means that So very long time ago, so about several decades, not several decades ago, but several hundred years ago, local issue remained. So in many cases, the local issue remained in the local issue later. For example, if there were the war situation about 500 years ago, usually that ended as the local war issue. However, in these days, how about the war situation between Ukraine and Russia? Even though there's a local war situation between those two countries, but the economic impacts or other impacts on these are widely spread out to the whole country on all over the world, at least in the economic condition, because so you might notice that the gas price increased a lot last year because of the war situation. So the wars in this kind of the risk situation, those kind of danger and the risk and other types of difficulties, and these are not remained in the local issue. So that's why we say that Ulrich Beck, the German sociologist, he argued that the globalization and the neoliberal the economic system, so there is no local situation anymore because of the globalization and the very active world trade system. So as we remember, the COVID-19 started from the specific country in the Asia, but that spread out the whole over the world. So in these days, it's getting better, and we cannot say that we overcame on the risks of the COVID-19 100%, but it got much better. But anyway, the the COVID-19 killed about 1 million people. About 1 million people in the United States only. So that's very huge risk in the United States. So those types of the risks are not limited in the local issue, but usually spread out to the global issue. And again, so those were, so the many affiliated countries, they were more open to the development of the COVID-19 vaccinations. So as you can see based on the latest data, there were the larger and the better the access to the vaccination in many of the developed countries. But many of the underdeveloped countries or the developing countries, they had the very low levels of the access to the vaccination. So you might have the very differentiated the belief about the vaccination, but as we assume, so if we assume that the vaccination is very effective way to prevent the chances of the infection with the COVID-19, the vaccination or the access to the vaccination is the key of the public health issue. But as you can see again, there were the very different levels of the open vaccination to anyone that's 61, the expanded vaccination to anyone over the 16. So we can see very different levels of the openness or the access to the vaccination. Oh, right. So the SES, so socio-economic conditions or the socio-economic status. So in your common sense or in most of the studies, they found that the high SES, which means the higher education, higher income, or any kind of the higher social status, these are associated with the better health condition. You might have the debate, you might want to tackle this issue that sometimes poor people can be healthier. That could be possible, I agree with you. But in general, so in average or in most issues on the population level, so there is a very clear tendency or there is a very clear trend that the higher social status is associated with the better health condition. So we would say that, you want to mention that because so the individuals worked very hard to get the very high health or high socio-economic status. So isn't it very righteous or isn't it very rational to have for them to have the very high health condition? So that would be very true. So they worked very hard to get the very high levels of the income and high levels of education level. But in the proposed definition, so we are not arguing that everyone should have the same health condition, but we would say that the health equality Or in other words, the health disparity means we are trying to find the ways to avoid the differences between the health condition between the groups of people who are more or less advantaged socially. So you would say that based on their social condition, they would have a very different health condition. But if those types of the differences in the health conditions are avoidable, so for example, if those levels of the different health conditions are originated by the different access of the health insurance, or the better access to the the meeting with the doctors, or the payment to the preventable health services. So these are something we can see as avoidable health differences. So these differences systematically place socially disadvantaged groups at further disadvantage, which means if they were born, for example, if they were born in the poorer family or the poorer groups of the people, and they are more likely to be the unhealthier compared with the higher social class people. So these are then if they are becoming more and more unhealthy, or the pre-existing inequality becomes higher and magnified after the disasters and those social macro problems. These are some types that we try to avoid as a part of that. It's not working. Sorry about that. So yeah. So this is this is that. It seems alright, so it seems I skipped one part. Sorry about that. So I'm coming back to the original one. So okay. So these are some types of the socio-economic condition. Socio-economic condition that based on the education level, for example, so which is a very big part of the socio-economic status, the risk perception. So based on the education, the highly educated people, they're more likely to have the risk perception and the preparedness behavior, the warning communication and the response. So for example, if they have the language skill or the social network, they would have the better access to the warning and the communication and that. So if they are disabled, they would have the less likelihood of the mobility or the very faster movement in the situation of the health problems, and the psychological impacts in the emergency response and recovery and others. So you would see that the social class or the social economic status, and these are differentiated by those social class. And the health condition. So, based on the COVID-19 hospitalization, based on the race and the race differentiation and the race disparity, the racial minorities were more likely to be impacted or the diagnosed in the COVID-19 and the hospitalization and the deaths. So compared with the non-Hispanic white, the racial minorities were more likely to suffer from those health conditions. So, on the inequality in the COVID-19, if you watch some of the videos of the inequality of the COVID-19, you'd be aware that the discrimination, the limited access of the healthcare service, and their occupation on the little bit relevant with their income, and their education and the housing and the geographic areas. For example, if they were living in the area with a higher population density, they are more likely to have the infection because of the higher exposure to the COVID-19 situations. And these are some of the more details about on those criteria. So maybe you can read over, because maybe just reading on those contents of those pages would not be very helpful. So discrimination and the healthcare and the access to the utilization and occupation and the education and the housing, these are all relevant with all these issues. So any videos, because I wanna read the time of this video, my lecture video, so I will not watch this video during my lecture, but I will add up the links to those videos that I wanted to include in the lecture slide, so that you can read them or you can watch over these videos later. And the social patterns of the misfortune, it means that, so the macro factors, I mean the disaster or the pandemic situation, and any kind of those levels of the risks and the chaotic situations, these are not solely distributed by the misfortune. So for example, in this class we have the A students. And then I cannot say, or I cannot assume that the COVID-19 impacted us just by the misfortune. So based on our age or the residential area and the other social conditions, these might impact a lot on the chances of the COVID-19 infection, or at least the timing of the infection, such as you might be exposed to the COVID-19 at the very early stage of the COVID-19 in the 2020, or you were diagnosed with the COVID-19 in 2021 or 2022 as a very later stage of the COVID-19 spread out in the United States, or in the Arkansas or in other parts of the region of the United States, there would be some very big pattern of the misfortune, not only the COVID-19 but also the disaster situation. So this is one way. So the health insurance, this is very big issue because, as you can see a little bit later, the health insurances are usually very, very expensive. So even though the healthcare services are very complicated outside of the United States, and even though the health expenditures are very high in the United States, but the levels of the health condition, I mean the levels of the health in the United States, these are relatively worse compared with the other developed countries. So let me share my experience in the United States. So as I came from the South Korea 12 years ago, so I could see very big differences, because in the South Korea, so I cannot say everything is better in the health the insurance in the South Korea, but at least there was the national health insurance service. But after coming to the United States, still I could have the very good health insurance service, because I was the state employee, and usually the state employee would have the better the health insurance service, because there are many very large numbers of the employees, and this is very good bargaining power with the negotiation with the health insurance company. But anyway, by all means, it was very good to have the better health insurance service, because I had a family. I have a very my two daughters and my wife, and having the COVID-19 situation, and that was very good, because it was very good condition to meet the doctors and with the better health insurances, and having the baby delivery and others. And the surprising bill. There was one issue of the surprising bill, because one time the nurse sent my wife's blood to the out of the network service without our intention and without our agreement. So that was the first time we got the surprising bill, because they billed us about $2,000 for the blood test, but having the insurance prevented a lot about that. So in my experience, because I served the military in South Korea, and I was injured on my waist and my back and my neck during the military service. But so in the military hospital, it took so long time, so I went out to the base, and then we went to the private hospital, and we took the MRI on that day, and it costed about $600 without the health insurance. So we can see that the very different levels of the health condition, health issues, and the universal health care services. So aiming that the universal health care services, and these are usually better in terms of the cost, because having the $600 for the MRI, that is much better than compared to the several $1,000 without health insurance in the United States. So on the universal health care service, this is the better condition in terms of the economic conditions. But we cannot say this is always very, very better, because sometimes some of the countries with the universal health care service or the community hospitals, the individuals or the patient need to wait a lot to get the access to the healthcare services. So we cannot say which one is ultimately better, but in terms of the healthcare services or the coverage of the healthcare services in the United States, and as you all know that the very large amount of the people they are outside of the access to the medical care or the preventive healthcare services. So that might be some of the issue we can see. Why the general health condition of the United States would be relatively worse compared with other developed countries. So you can read over this history and others, and the history of the other healthcare services. So sociology of the medicine. You might take this course, or you already take this course. So in sociology, we put more focus on the sociology instead of the medicine because of the sociological issues. And so as I mentioned that, what are the health equality or disparity or equity? So as I mentioned before, the health inequality or the health equality does not mean that everyone should have the equal health condition. So health differences are not only necessary and avoidable and unfair and unjust. So this is the very unfair on the definition of the health equality or the health inequality. Everyone should have the fair opportunity to attain their full health potential, and more pragmatically, that no one should be disadvantaged from achieving this potential if it can be avoided. So you just can feel. So I would say this is a very important part of this lecture, because you may say that the inequality. So inequality would be inevitable because some people are very healthy because they are very economically very advantaged, and they worked so hard, and they also exercise so hard. So this part of the differences would be very partially necessary. So because they worked hard and they deserve to have the better health condition compared with those who do never exercise and have the very bad diet habit or others. But in other way, if there are some of the avoidable, very, very avoidable levels of the differences of the health condition, and if they could, so some of the differences in the health condition, and these were originated of the very differentiated or the very lost opportunity of the access to the health condition. So that's why on the fair opportunity, having the fair opportunity to get the health condition and avoiding some of the unnecessary or unfair and unjust health problems would be very, very useful. Alright, so these are the explanations of the avoidable and unfair and unjust, and which is also very important part. So I highly recommend you to focus on this part as well as the textbook. Alright, so again, the proposed definition and others, and I would recommend to review this part again and again and prepare this part for the final exam. Alright, so this is the end of the first lecture video, and see you very soon in the next video about the health condition and the population health.